was an incredible shock to receive that information very early yesterday morning. We were waiting on an announcement from the government, but didn't expect to hear it in this way.
So give us an insight into what kind of discussions that there have been over the past several years on this.
So I've been involved for the past 6 years in working with the ABS. We were attempting to get these questions into the 2021 census and we failed. As a result of that, though, what the ABS was able to do was to do a review of the current standard they had for collection of sex and gender data. That then turned into what we now know as the 2020 standard, which has a collection of variables to capture questions on sex, gender, variations of sex characteristics and sexual orientation. Now that we had that set of questions, that's what we were then advocating and working with the ABS to include into the 2026 census. So the work that we've done to date has included lots of consultation with the ABS and of course with government, and also we sit on the expert advisory group that the ABS created for the which they had done in 2021 to look at the 2026 census.
And so taking into account all that work that had been done, were you actually pretty confident that they were going to be positive about including this in the 2026 census?
I was confident on some questions and less confident on others, but I was hoping that the evidence for the inclusion of these questions would lead the way and that we would follow this abundance of evidence and the call for this data in the census and these questions in the census, not just from LGBTQ plus people, but from bureaucrats, politicians, academics and the like, organisations, businesses. This is important data.
Yeah, and so why is it so important?
It's important because I think in Australia, as in many countries, people think the census is just about counting all of us, when in fact the data from the census is what's responsible for assisting in planning, looking at financial investment, looking at where hospitals are built, where schools are built, etc. We have incredible health disparities and we need to know where we're living. We need to know the impact we need to know about all of the information that we garner from the census, but with an LGBTQ plus lens across it so that we can understand what we need to understand for good investment. We're living in very tight fiscal times. We can't afford to waste money. Knowing, for example, that there's a higher population of LGBTQ plus people in area X means that when money becomes available, we know that we need to target there. Not that we wouldn't look to invest in other areas too, but having that lens is critical, as it is now across the broader population.
What do you say to some people who might argue why have a special question for that particular group of people?
It's not a special question for a particular group of people. It's a set of variables that have been released by the ABS as the correct way to gather data. There's also just recently through the National Medical Health Research Centre, which is at the NHMC, a national research body with the Department of Health and Ageing, just recently released a statement stating that these questions are really important in research. That also covers the 2026 census.
And this research, this data can end up making a material difference to people's lives?
An absolutely material difference. I mean, I sit in a number of meetings where we talk about the health disparities and what we need to do, and the question always gets put back to me, Nikki, what about the data? And we're saying we're working hard to get that baseline population level data out of the 2026 census.
And so have you got an explanation as to why the decision was made not to include these sorts of questions in 2026?
No, we're still waiting on a decision and the explanation, I'm sorry, thank you. We're still waiting on that and hoping that we will be able to understand that. The thing I suppose that will be sitting with me is that the decision goes against the evidence, and the evidence outweighs absolutely the need for the data. And that is what we're focused on. It's more than these questions that some people are upset around, the fact of asking questions on sex, gender, variations of sex characteristics and sexual orientation. It's the data that comes from that. It's life-saving data.
And a bit of a mystery to you now as to why this has been rejected?
It is a mystery, yes.
And so what's the strategy now?
The strategy now is that we'll continue to have conversations with government and with the ABS. We really value our partnership with the ABS. It's an important one. And where we're focused now is on the 10-year National Action Plan for LGBTQ plus health and wellbeing, which was announced in March 2023 by the government. We want to see that plan launched, we want to see it resourced, and we want to make sure that it fully addresses the health disparities of LGBTIQ plus people.
And the next census is 2032, is it?
It's 2031, yeah, right. 2031.
And so you'll continue the fight for the next census?
I will continue to fight, but I'll likely also be retired, I think. But certainly, I always used to tell people, I wake up and every morning I see 2026 etched on the inside of my eyelids. It's been such an important journey to get these questions into the census. I'll continue to ensure that those questions get into the census, and LGBTQ plus Health Australia and all of our member organisations will continue to do that too.